So if you have shoulder pain that you're trying to treat, you're doing exercises for it, and you're using that lacrosse ball and it's just not going away, it's because you have adhesion in your rotator cuff. And what those things are doing are just not addressing that issue. So what we do here is once we identify that you have it, and that's what we found here in the teres minor here, is that there's some adhesion, right? It doesn't compress well, shoulder pain, not a lot of range of motion. So now we have this here, we're gonna put that thing on tension, and now we're gonna use our radial pressure wave to melt that scar tissue away. So as I turn this on, the scar tissue is on tension here. We're just gonna work through the whole length of that muscle. And what we're doing is putting hyper concentrated sound waves in here that are melting away any of that scar tissue that's built up in there. And as we do this, we see an increase in range of motion that is going to sustain, and we're going to be decompressing the shoulder or any sort of tendons that might be irritated, overused, or inflamed.